often hiding or crying or wanting a cuddle or wanting a nappy or denying that they need to go. And the kinds of triggers I touched on briefly, but another one is when they go to kindergarten or school and the toilets are nasty and dirty and there's no door and there are bullies and they turn off the lights and people put their heads under, kids avoid the toilet, and then they can get into this pattern even as older children. And so we treat it basically by eliminating fear by making the stools extra soft. That rectum is really weak, so it needs extra soft poo to be able to eliminate it fully and keep that rectum empty for months until it comes back to normal and the fear is gone. And often the rectum's better before the fear is gone, so we go for months and months. And if they do have accidents while we're starting laxative treatment, often that means we haven't got there yet, we've still got a backlog, so push on with treatment rather than backing off if there are more accidents in the initial phase. So we're educating the family to say this isn't the child's fault, it's numb, it's weak, we need to give the medicine to stop it. Also, the medicines are safe. It's really important that everyone know the laxative medicines we use, including the stimulant laxatives, will not cause long-term harm. We emphasise that it's treatable, but you have to treat it for ages. And we want to keep those stools soft, get them sitting properly on the toilet, and do timed toileting because it is numb, so we sit them on the toilet after meals when the motions are generally moving in the forward direction to try and get motions in the toilet and reward success. And so we talk to them about how to let the child do a poo. If the child is still asking for a nappy for defecation, allow that until the constipation and the fear has been sorted out, then move on to the toilet training for stool, even if they're toilet trained for wee. And there'll be a lot of talk about how you sit on the toilet if you're a person sitting on a toilet and the correct posture to do so, and that's obviously something we really reinforce. Sometimes we even ask for access to staff toilets at school if the child won't use the kids' toilets, just to get over this problem. And we do the time toileting only for 3 minutes after meals, not for ages. And we use medicines that are either softeners, almost exclusively now we use the polyethylene glycol ones, so Mubicol, Clearlax, Osmolax. Less often we use Parachoc, and virtually never do I use lactulose. It causes nasty side effects, abdominal pain, wind and so forth, even in babies, and I don't tend to use it at all. But quite often we'll add stimulant laxatives to try and get the motions going, either as a rescue if they haven't had a motion for 24 hours, add it to their softener, or even some children need stimulant laxatives daily for a while. And we use the softeners to get the texture, and we want the texture as soft as wet cement, and we use the Bristol form scale to show that, and we might add stimulants to get it daily if it wasn't daily once we made it soft. And we want a type 5 or 6 on the stool form scale, and we give parents this chart so they know. I'll skip over that. And it's to do with taste and ease of disguising and expense, but almost always the polyethylene glycol wins out. There's no randomised trial to tell us how long to go, but we go for minutes. I'm getting a 1 minute in the sun completely, but we go for months. So 3 months history if there's a brief, 3 months treatment if there's a brief history, 6 months treatment if there's a long history, and if they've been fearful or they haven't been toilet trained yet, they need 6 months treatment after they're toilet trained, in my view, to make sure that they don't relapse, because that's the commonest problem is the parents think they're okay, stop, and then everything starts again, and everyone gets more and more upset. And we can even treat fecal impaction. We don't need to use nasogastrics anymore. We just use more polyethylene glycol, industrial doses of that at home, and usually we can get rid of even enormous fecal masses. And we use washouts in bottles or shot glasses or whatever, and you can read that from your notes, the different rates. And we use occupational therapy, and I understand there are a lot of you here today, and obviously very valuable. If the initial treatment isn't working, we refer to occupational therapy for advice on positioning and routines and taking medicines and rewards for the child for participating in treatment. And also physiotherapists for children who need to learn how to sit properly, especially if there's anything that suggests to me that they've got an obstruction due to pelvic floor. So if they're trying with all their might to do a motion, can't do it, hop up, have an accident down their legs, strongly suggests to me that they've got some problem with their pelvic floor. If they're digitating their bottom, or if they're lying against the wall with their legs up to try and pass wind, odd positions and postures are often a signal to me that a pelvic floor problem might be the underlying trouble. And biofeedback is something we use, which is in the defecation area quite experimental but well recognised in urination in terms of using surface EMG to tell the child when they're contracting their pelvic floor muscles inappropriately and trying to teach them how to relax when they're going to be eliminated. And I think we're probably nearly out of time, but the reasons that they might fail is if you didn't use enough medicine, you stopped too soon, they didn't use it regularly, they used it as needed instead of daily treatment for months and months, or if the trigger factors came back. And finally, if there's an allergy to a food, such as the child's had eczema or they don't like milk or anything like that, those are triggers for me to think that cow's milk might be part of their problem. I think that'll do. That's just like, how do they sit when they do a poo, and is it as soft as wet cement? And that, I think, is that enough? Yeah. So I could tell you all, but I could talk all day on my constipation story, so anyone who needs further information can come and talk to me at the break.
Thank you very much, Frances. That's really interesting. Actually, very behind, we don't have time for questions, but Frances will be available during the break if you want to approach her and ask her something. So we are now breaking for morning tea until 10:45. So the room at the back has the catering set up. There's tray tables as well that you can look at. If you have any special dietary requirements, the food is up here at the bar. Thank you.